So first of all, you can see here now this painting of the anal channel with a hemorrhoid, it is shown, and also with a already insert anoscope. We use normally an anoscope with a diameter of 2 centimeters, which is almost suits everybody. Only in really very small women, which have a very tight anal channel, we can use sometimes smaller ones, but in the normal time we'd use this one. It's 2 to 3 centimeters, and this is very good for the procedure itself because you need some space and an overview. So what we do first is to insert this anoscope and then check out for sure the different hemorrhoids. What you can see here in this painting is a little bit different to this, what we use now after a lot of experience, because the proctoscope, which we have now, you can see later in the live demonstration, at the tip of the proctoscope is here a little space that the hemorrhoid has the possibility to move inside the proctoscope, make the overview better, and for you it's easier to insert the probe later. But you will see it in a live demonstration. So what we do in the procedure, we start with the injection of local anesthesia. Very important here, I think this is one of the most important steps, is to make the injection in the right position. You need the injection between layers. It should be first make a local anesthesia, that's sure, but the second effect is to protect the layers which are under the hemorrhoid. That means you inject the local anesthesia under the hemorrhoids, not in the hemorrhoids. You should really avoid to have a balloon effect and don't blow the hemorrhoid up. You put it under the hemorrhoid and between the layers. So you have like a pillow of local anesthesia, which is shown in this picture as a green area. And there you can see that it protects on one hand the muscle and on the other hand the hemorrhoid itself and the mucosa. So it divided these 2 layers, and that is most important. When you go on then, we just insert the probe. We do this with this single stitch which I told you, and we try to bring the probe up to the beginning of the hemorrhoid or to the base of the hemorrhoids where we think that the feeding artery should be. Because we don't want to treat in this procedure only the hemorrhoid itself, the corpus, the vessels of the hemorrhoids. No, we want to treat also the feeding artery in order to reach a very good result, even for a longer time, in a longer follow-up, and not only for a few moments or a short time. So we insert it to the center and very deep in this upper part of the hemorrhoid, and there we think is the feeding artery. Well, to go on with the procedure means we will now, in the step to applicate the energy, which we will do, but here is very important what I told you in the beginning, when the needle is inserted, that we can now lift up the needle to the center of the anal channel in order to avoid damages again, because the heat which we apply here, which we put inside, is up to 100 degrees. That means when you are too close to the muscle layer, you can cause damages. And on the other hand, also possible is that the heat, which is not good influenced by local anesthesia, can be felt by, felt by the patient. That means we should avoid this and try to lift it up as much as possible. So then we give the energy, like I told you, with this 25 watts. And in this area, we will see a reaction. We do this in the first time about 10 seconds. This machine gives also a signal in a tone, which you can hear. We will hear it later in live demonstration. And for us, we can count, for example, the beeps, which are produced by the machine, or you just count 10 seconds. But honestly, when you do it further on, and very often, you treat normally with a view to the tissue, and you can decide how much energy you will apply in order to the reaction of the tissue. So what we will see is a reaction, which means the hemorrhoid itself will shrink, and the color of the tissue, which is normally, as you know, a little bit blue or red, will change to a more white or gray color, and that means the reaction is very good because the perfusion reduces. So this is what we do in the first step, and then afterwards, when we have done this the first time in the first cycles for 10 seconds, We go on with a repeating of the same thing, and we use the needle in this time all the time over the same injection point, and go step by step like a fan in this hemorrhoid in order to reach every area, and do this 3, 2, 1 time, how often you need in order to treat the whole hemorrhoid, depending for sure on its size. So what is important then to go further on, when you remove the needle out of the center, you make for sure that you give energy on the injection point, because in this moment, when you just remove the needle, it can bleed, what we want to avoid. So in the end, in the injection point, just keep the needle a bit inside and give again energy, and then you can reach that there's a coagulation of the injection point, which is very important. Afterwards, we just treat now the rest of the hemorrhoid. Why? The hemorrhoid itself has a diameter. When we put inside the needle and start to treat, we cannot be sure that we reach with our heat the complete hemorrhoid, even the surface, because we started, as I told you, in the deep base. That means it could be that there are parts of the hemorrhoid still active and still not treated, which are more in the surface. So in the end, we just take out the needle and treat the surface with several spots. How many spots you need depends on the reaction of the tissue. You will see it when you just do it. So then we give again on some places this energy in small spots to treat also the surface. I told you one of the most important things is the injection of the anesthesia. What is also now the second very important thing is to communicate with the patient. We have here the incredible advantage that we can talk during the operation with the patient, which is very, very seldom. Usually these operations, as everybody knows, are done in general anesthesia. You have no feedback of the patient. Here is the extremely good advantage that you can talk to him. He will tell you if it's too hot, if he has pain or anything else, uncomfortable feeling, whatever. So you can react. That means every time when it's too hot or too painful, you can just change the location and go in another position with your needle, or just stop it for a while, or what is important, what I show you now in this slide, that you can cool down the area. And this is not very difficult. Just take a cold gas, what you can do by just tap water. It must not be frozen, because your body is 37 degrees temperature. So everything what is about 15, 20 degrees is cold. It's enough to cool down. You don't need, ice cubes, which is not very comfortable for the patient. So try to just cool it down, and then you can change the position and do it again.
One which is opened to one side. Everything okay with you? Okay. So now I can show you the situation inside. We will focus, and I will give you a light here. And this is the hemorrhoid at 3 o'clock to 3 o'clock. And you can see that it's right on the border from the anal verge, from the anal mucosa to the rectal mucosa. And this is very important because we have to preserve the anal mucosa in order to make sure that the patient will not have any pain. So first step will be to make the local anesthesia. It will come now. And this is the next important step. I have to go inside, and I have to go between the muscle layer and the submucosal layer. And this is also important because the danger is to make a blow up of the hemorrhoid, and this is not good for the coagulation afterwards. So this is what I made, and now I will go inside with the special device for radio frequency treatment. And what I will do is now to make a coagulation on one side of the hemorrhoid. This will start now, and I will give energy like 25 watt, and at the end we will see how much energy we gave. Okay, now I will change the direction. Can you see it? Very good. Okay, I think that you can see it. I will change the direction to the other side, and important is that I will that you don't touch the muscle layer. So go into the lumen. Okay, that's it. And now the next step, I will retract a little bit the device, the tip, and now I can show it to you. And now is the next step, also between the muscle layer and the submucosal layer. And what you can see now is that the surface of the hemorrhoid will be a little bit pale. This demonstrates us the coagulation zone. Okay, that's it. And now I will change to the last step. I go inside. Everything okay with you? It's not warm?
Just a little bit.
Okay, thank you. Okay, that's everything. And if I move and remove the needle, I will go outside. Oh, it's a little bit heavy to go outside, and it will make a coagulation point just at the point where I introduce the needle. So now I will clean a little bit, and in this case, you have to be in contact with the patient, or in this situation, because we have to demand him if he has some pain or if it's too warm or so, but in this case everything was good. So now I will go for the surface coagulation. Can you see it? Okay, that's like this. This is the surface coagulation, and we will do it because we want to create a scar and a retraction afterwards. Okay. Okay, this was an excellent, and I think we will make another cleaning of the situation, and then I can show you the note, which is there's a slight bleeding, but don't worry if you have such bleeding, not really pulsating bleeding, a bleeding like this one, we can leave it like this.